Dear students, hello. Ms. Khan here today, and today we'll be talking about effective communication in mental health. So the objectives of this presentation are develop effective therapeutic communication techniques, and you'd ask me what is therapeutic communication, and we'll talk about it in detail. We will also differentiate and critique the nurse's role in establishing a therapeutic environment. There are certain different levels of communication. There's intrapersonal level where it occurs within an individual. I don't know if sometimes you find yourself talking to yourself. And not only that, the thoughts that go through your mind and things that you tell yourself. That communication is intrapersonal. Interpersonal communication is one-to-one interaction between two people. Transpersonal communication is interaction in a person's spiritual domain. Oftentimes it's between a person and a higher power. Small group communication is, of course, it's interaction with a small number of people, and public communication is interaction with a large number of people where audience are required. And electronic communication is using technology such as emailing, messaging, to ensure the timely communication between the patients and the healthcare providers. So now that brings us to therapeutic communication. Keep in mind when we talk about mental health, therapeutic communication is the foundation of mental health therapy. It's a foundation of a nurse-patient relationship. It's a purposeful use of communication to build and maintain helping relationship with patients, and not only with patients, with their families and their significant others, because patients with mental health problems, they need support from their families and their significant others. It is very essential for caring for a patient who has mental health disorder, because this disorder does not only impact their emotional well-being, but it also impacts their physiological well-being. So we have to build a therapeutic relationship with them and establish therapeutic communication. But you have to keep in mind that this communication is patient-centered. It's about patient, not you as a nurse. It's not social, and it's not reciprocal, because from that communication and relationship, you're not getting anything out of it. It's all about patient. Patient is in the center of this communication and relationship. It should be purposeful, planned, and goal-directed. Now, when you establish communication with patients with mental health problems, there are certain things that you have to keep in mind when we talk about verbal communication. First of all, your vocabulary should be appropriate. Make sure either you're communicating with them written or spoken message. Use appropriate vocabulary. Do not use medical jargon or complicated words, or do not use any words that are difficult to understand, and they can decrease patients' understanding. And then also, the denotative aspect of your communication, when participants must share meanings, just keep in mind some words may have multiple meanings. So you might be saying something and your patient might perceive it differently. So avoid using those words. Use simplest, shortest words and sentences. Be clear and concise. Make sure the timing is good. If the patient is not feeling well, or if they are irritable, or if they're in pain, or if they had an episode of stress or anxiety, then they may not be receptive to your communication. Also, pace yourself. Don't talk too slow, don't talk too fast. Just pace yourself, do not be in a rush. Just let them know you are there for them. And last for not least, intonation, which is tone of your voice. Do not sound judgmental or angry. or the patient. Just make sure that you sound that you have that you have acceptance for them and caring. Your tone is caring and it's non-judgmental. So because patients, they pick up on those cues. And now we come to the nonverbal communication aspects. Nurses should be very cognizant about nonverbal communication, but because patients with mental health, they pick up on nonverbal cues a lot. Sometimes you have to be cognizant about patients' culture. I know we talk about eye contact, but keep in mind some cultures, they may not like people looking into their eyes. People from certain cultures, they don't. And even patients going through certain mental disorders, they might feel threatened if you are looking into their eyes. So just be cognizant about it and assess the situation whether or not you should make an eye contact. It can have more impact on the message compared to the verbal words. So just have cultural considerations in mind when you're making nonverbal communication, how their appearance is, how your appearance is, how your gesture is. Do not be closed. Just sit with your open arms. Your facial expressions are kind and caring. And whether or not you have to make eye contact or not, what kind of gestures you're making, what kind of sounds you're making, just respect their personal space. And most importantly, sometimes use silence as a way of communication. Sometimes patients, they just need your presence to be there. That's all they need. Use silence as a form of communication, therapeutic communication. So again, just to summarize what I'd said before, plan and allow adequate time to communicate. If patients are depressed or if they have schizophrenia, they would take longer time to respond to questions. Be an active listener. Give them time to share their feelings and express their thoughts. Eye contact, typically it conveys interest, but it conveys interest and respect, but it varies by situation and culture. Just like I said, patients with certain disorders, they might feel threatened. So just be cognizant about it. Patients with certain culture may not like you looking into their eyes. So body language, observe patients' body language. It can demonstrate their level of comfort and ease. Vocal quality, it enhances rapport and it emphasizes particular topic or issue. Silence, I already emphasized on. And using therapeutic touch, again, be careful about it. Just a gentle therapeutic touch, it goes a long way. But again, you have to be careful about it. You do not want to invade patients' personal space, and you do not want them to feel threatened. Patients do value face-to-face communication because many of these patients are lonely and they're scared and they're anxious or they're depressed. And the therapeutic communication actually ends up being a foundation for a healing relationship between a nurse and a patient. And you can empower patients to make their own decisions through therapeutic communication. And just by being attentive and staying quiet and thorough listening. And just by asking relevant questions, by gentle touch or sharing feelings or clarifying. So there are some techniques that I have summarized here for you, but I would encourage you to look into your textbook and look at more of these techniques. Verbal tracking it, you're providing feedback by restating what patient has said, so that would validate that you are listening to them attentively. Show a caring attitude, be honest and open. Make sure that they can trust you. Empathy, I always say, convey an objective understanding of their feelings and their emotions, because putting yourself in their position can help you be more compassionate towards them and their families, and you would be more open to help them. And be non-judgmental. Do not judge patients with mental health issues. The display of acceptance will encourage open and honest communication. So here are some examples that I have for you. If you're trying to use the general leads, if a patient is they're not able to go on or they're not able to put their thoughts together, help them. I see. Okay, tell me more about this. Or go on. Or use open-ended relevant questions. Do not beat about the bush or don't go in random circles. Tell me more about what you were talking about or what is the problem at hand. Share observations. You seem to be in more pain today. Just kind of validate how they're feeling. Summarize. So far we have talked about this. We have talked about how you felt when this happened. Summarize this. Or did I understand you right? Or did I understand you when you said this? So just clarify it, or restate or reflect. But again, make sure that the communication is patient-centered. It's focused on them, not on you. So here's our practice question. A nurse is assisting with instructing a class on therapeutic communication with a group of newly licensed nurses. Which of the following aspects of communication should the nurse identify as a component of verbal communication? Personal space, posture, eye contact, and intonation. Yes, personal space, posture, and eye contact are forms of nonverbal communication, so intonation would be your answer. Good job. So now we've talked about therapeutic communication, but now we're going to talk about therapeutic relationship. How can you create safe environment for your patients, therapeutic environment for your patients? One of the most common therapy that we use, it's called milieu therapy, and it creates an environment that is supportive, it's therapeutic and safe. And when we talk about milieu therapy, just keep in mind that every incident, every time or every opportunity is appropriate for milieu therapy. So any opportunity you have with the patient, any interaction you have with the patient, consider it an opportunity for milieu therapy. And it can also be referred as a therapeutic communication and therapeutic environment. Again, I can't emphasize enough that nurse-patient relationships are the foundation of clinical nursing practice, not only in mental health, but any clinical nursing practice. They promote a psychological climate that facilitates positive change and growth. So the primary purpose is to identify patients' problems, patients' expectations, patient needs, and then focus on assisting the patient in meeting or resolving those issues. And there are some phases of therapeutic relationship that you should be aware of. First is pre-orientation phase. This is the phase when you hear about, okay, Nicole, you're going to be taking care of Mr. Smith. Mr. Smith hasn't even arrived yet. He's not excluded in this phase. He's not included in this phase. You have just heard from your chart nurse that he'll be arriving. He has a history of bipolar depression, and he had attempted suicide, and he has been in rehabilitative services, and now he will be coming to your clinic for more supportive services. He's been discharged from rehabilitative services. So you haven't quite met the patient, but you are building a picture in your mind. And the patient is not there. The patient is not included in this phase. But you're kind of feeling a certain degree of anxiety. I don't know how Mr. Smith is feeling now. Did he make any progress or not? Is he still feeling suicidal? I hope not. I hope he's not trying to hurt himself anymore. The pre-orientation phase is where you're trying to prepare yourself with this patient and how you're going to be thinking, okay, how I'm going to be interviewing him and how I'm going to be implementing therapeutic communication and what kind of interview techniques I'll be utilizing with him. You'll be digging into his chart, you'll be gathering his data, you'll be getting report from where he's coming, you'll be asking the charge nurse. So, and then also The major task is to develop self-awareness, which is to assess your own biases. This is the most important thing, dear students. Major task is to develop self-awareness, is to address your own biases at this point before you encounter your patients, because you want to walk into that relationship with no judgments, with empathy, with compassion, and with openness. So now you move on to the working phase where you actually meet Mr. Smith. It's highly individualized. Again, I can't emphasize enough that it's patient-centered. It's very structured, and it's the longest and most productive phase of therapeutic relationship. Limit setting is employed. You will ask Mr. Smith what his expectations are, what he's expecting to gain from this therapy and these visits to your clinic and these encounters, and how can you help him to achieve optimal health. And major task is identification and resolution of the patient's problems. You can make some recommendations and allow Mr. Smith to make his own decisions, empower him and help him, assist him and lead him and guide him. But you cannot make those decisions for him. Again, it's his expectations, it's how he wants it. And then, last but not least, there is termination phase. It's a gradual weaning process. Consider it discharge. Remember, from Foundation, we teach you that discharge planning should be done from the admissions. Same here, termination phase, you should be actually teaching patient about it from the working phase, but it should be recognized in orientation phase that how would you tackle it. It's somewhat little sad. There's feelings of anxiety, fear, and loss because it's time to say goodbye. But again, the task includes evaluation. You will assess Mr. Smith's evaluation. Hopefully he has progressed through his encounters with you and when he has sought help. And the major task is to assist patient to review what they have learned and to transfer his learning to his relationship with others and how they can promote optimum health and they can better their mental health later on beyond this clinic when they go into their own life. So how can they implement those strategies? Some barriers are you do not want to give your patients false assurance, do not give him advice, do not be judgmental, do not change the subject, don't use closed-ended questions, do not use leading questions, and don't ask her personal questions. Okay, so practice question now. An angry client on an inpatient unit approaches a nurse stating, "Someone took my lunch. People need to respect others and you need to do something about this now." The nurse's response should be guided by which basic assumption of milieu therapy? Conflict should be avoided at all costs on inpatient psychiatric units. Conflict should be resolved by the nursing staff. Every interaction is an opportunity for therapeutic intervention, and conflict resolution should be addressed during group therapy. So remember what I said. Every interaction is an opportunity for therapeutic intervention. So the nurse's response should be guided by the basic assumption that every interaction is an opportunity for the therapeutic intervention, and they can utilize milieu therapy to affect behavioral change and improve psychological health and functioning. So this concludes our presentation, dear students. Thank you for getting through it, and if you have any questions or concerns, feel free to reach out to me via email, or we can talk about it during our lecture, in-person lecture. Thank you.